Please subscribe to Facetv Africa and turn the notification on. Facetv Africa, ẹ jọ̀ọ́, subscribe, hete.
Face TV was Swoby.
Shettima Parleys with governors, brigades, Dangote speak on primary healthcare finance. Vice President Senator Kazim Shettima says Nigeria will address the concerns that surround the financing of the primary healthcare system in the country. The Vice President stated this Thursday at a parley with some governors under the auspice of the Nigerian Governors Forum, Alhaji Aliko Dangote and Brigade at the Banquet Hall Presidential Villa in Abuja. While acknowledging the threats facing Nigeria in the area of polio, the Vice President further stressed that the federal government is committed to eradicating virulent poliovirus by the end of the year, ensuring that every Nigerian child is covered in the routine of immunization campaign.
We don't intend to slow down until we deliver on our promise to eradicate the virulent poliovirus by the end of 2023. We won't stop until we build a robust institutional framework to ease access to vaccines and ensuring palliatives. We won't stop until we are sure that the resources deployed by our partners and our counterpart funding are disbursed for the intended purpose. We won't stop, ladies and gentlemen, until we are sure that the children in our remotest villages have access to first-rate primary health care and nutrition like their peers in our cities. We are going to address the concerns that surround the financing of our primary healthcare system, from our proposal to provide timely domestic financing or the procurement of vaccines, which couldn't have come sooner, to boosting our industrial capability to produce vaccines. The federal government and our respective state governments are going to set in place a transparent process and structure to undo the reality of the country as one with one of the highest proportions of non-immunized infants in the world over the last decade.
Since Bill's visit in 2018, we have supported the government's efforts on human capital development. We genuinely believe that the National Economic Council and the decisions that you make together over the next 4 years will determine whether Nigeria has strong economic citizens healthy, contribute to achieving the United Nations Sustainable Development Goals. To achieve all that, as you begin to think about what topics to prioritize at the NEC and Nigerian Governors Forum, I would like to call on all of you to put human capital development on top of your list. It is very, very important to have it on top of the list. Together, using this unique platform, we can collaborate closely and make investments and policies that will ensure that our people have health and opportunity.
The root causes of the insurgency are mainly three: increasing infrastructural deficit, increasing poverty, and climate vulnerabilities. As we work towards recovery and further building the resilience of our people in Borno State, following the devastating impact of Boko Haram insurgency, I would like to specifically request for your more support towards improving agriculture, working directly with smallholder farmers and government and national NGOs that are not afraid to go to where poor people live in need.
Because without our intervention, some of us at the subnational level will not even know how to really dispense services and to do so much. I can remember the Seattle Declaration that you urge us to do primary health care under one roof, involving the community engagement in governance. So it is a governance issue, managing scarce resources to do so much. And the MOU that we have signed, Bauchi is one of the states that benefited. And today I can say without fear of contradiction Though we have done so much because of the templates that you have brought out. I want
area of polio eradication that you have done, human capital development that you have assisted, agriculture and the rest of that. But one area that I believe we can still look at, today in Nigeria there is no functional vaccine research and production area. We were faced with that challenge when COVID-19 actually showed up. I want to offer Nasarawa State for you. Nasarawa State is similar to what you can see actually in Washington, D.C. and Maryland, or Lagos and Ogun State and the rest of that. And a good example to tell you is recently Nigeria had their trial census. When they had the trial census, one local government is taken out of all the 6 geographical zones. Locally for us, Nasarawa State was selected and Karu local government was selected. Karu local government is the fastest growing local government in the whole of Nigeria.
Please subscribe to Face TV Africa and turn the notification on. Face TV Africa, subscribe, hete.
Face TV was Swoby.